This is how it starts.
They say there's no fighting in the playoffs. Tell that to Vegas and Edmonton. They've been going at it. Now, new warnings about the long-term risks.
What we found shocked us.
Dr. Charlie Popkin is a surgeon at Columbia University and a doctor with USA Hockey. He compared long-term health data of enforcers, players with 50 or more fights, and other NHL players over 55 years.
And what we found was, in both of those groups, the enforcers were dying a decade earlier than their peers and more likely to die from suicide or drug overdose.
In 2011, the overdose death of Derek Bugard, suicide of Rick Rippon, and suspected suicide of Wade Belak, all NHL heavyweights, posed big questions for hockey.
But this is the first study to actually systematically review how different their causes of death are than hockey players who weren't involved in a lot of fights.
Dr. Chris Nowinski says the findings support links to chronic traumatic encephalopathy, CTE, a brain condition believed to be linked to repeated blows to the head.
Things that we associate with CTE, right? We have suicides, we have drug overdoses, automobile accidents, for risk-taking behaviors.
Other than some anecdotal evidence, there has not been that conclusive link.
The NHL has yet to acknowledge CTE, but fighting is down, about 77% since 2000. The game today is faster, requires more skill.
I think that also plays a huge role in why we're seeing the role of the enforcer kind of die out the way that it has.
Still, says one of Canada's leading concussion experts, the NHL can do more.
There's too much risk-taking behavior, and it's causing brain damage.
The NHL didn't respond to a request for comment, while the NHL Players Association says it's looking at the study. Meanwhile, in the heat of the playoffs, it's bound to get rough. Cameron McIntosh, CBC News, Winnipeg.